Let's turn to our newsmaker tonight, and he is a very special guest. Tonight, Dr. Ravi Kannan, renowned oncologist, has been just selected last week for the Raymond Magsaysay Award 2023 for his contribution in the health sector. Dr. Kannan left his job in Chennai to help the people in Assam, Silchar and Kachar district fight cancer in 2007. Once in Assam, he found cancer patients were not returning for treatment, and he implemented several low-cost cancer treatment measures to ensure that these individuals could undergo the necessary treatment, including providing ad hoc employment to family members of the patient to ensure they didn't feel any financial burden. He also sent hospital staff to villages to teach families how to take care of patients at home. He's a remarkable individual, and we are very privileged to be joined by Dr. Kannan. First of all, sir, congratulations for the Raymond Magsaysay Award. You must be mightily pleased that your work on providing affordable cancer care in a remote corner of the country is being recognized now internationally.
Thank you. But I think it's not really about me. I think it's about, 450 colleagues of mine in the hospital, about the society that created the hospital, about the community that supports us, about people in the region, in other parts of the country and elsewhere, people who've never seen the place, never seen the people there, but who are willing to support, to bring about change in the lives of fellow human beings. I think that's the spirit the award recognizes. I don't think it's really about me.
No, you're being very modest, Dr. Kannan. Not too many people would live a very comfortable life as a doctor in Chennai to then go and work with a cancer hospital and research center in a remote corner of Assam and then help build that into an institution, a movement. So it's your journey that is inspirational in a way. How did you see your move from Chennai to Assam? What really drove you to do that?
So the hospital was started by a local society. Lay people got together and created a society because those days the nearest hospital was in Guwahati, which is about 350 kilometers away. Even today, sometimes it may take us as much as 20 hours to travel there. And so that was a disincentive for people to go and access treatment and complete treatment. And so they formed a society, and the former director visited a number of cancer hospitals to see how a hospital should be run. I used to work at the Cancer Institute in Chennai, and he spent some months with us, and then he was in regular touch because he used to keep referring patients across. And when I left the institute, one day he called for something, and one thing led to the other. And then he invited us to go and join them. At that time, all we knew was bomb blasts and floods, and my wife Sita said, we will not go to Assam. But they kept calling again and again, writing letters, and so we went on a visit. And then I spent time in the hospital, and they took Sita around the community, around the hospital. We went looking at schools, and the school principals were so supportive. And so before we could come back, my wife said, there's a lot of need here. This is what we should be doing. And so when we came back, she resigned from work. She initiated the discussion in both our homes, and we came here.
That's quite remarkable, because what you've done in the process, you filled an important gap. There are large parts of the country, not just in the Barak Valley, but across India, that don't have access to affordable cancer care, because a lot of the best cancer hospitals in this country are only situated in the big cities. Is that the change that you would really like to see, that affordable cancer care now spreads to every corner of this vast country?
Definitely. Definitely. Where you're born and where you live should not dictate how you live or whether you live at all. Everywhere, the access to care has to be uniform.
In that sense, do you believe that we still have a long way to go as a country, and that we need to prioritize providing affordable cancer care? That should be the priority, in a way, of a public health system.
Definitely. We have a long way to go, but we are on the road. These changes will not happen overnight. It may take several years, maybe sometimes much longer, but eventually we will get there. If the vision is there and if the intentions are there, we will get there eventually.
But what for you in this journey, Dr. Kannan, has been your biggest learning, or should I say your biggest source of satisfaction? What's the biggest learning first?
The biggest learning for me is that just providing low-cost care, boarding and lodging will not ensure that people will actually come and accept treatment. For poor people, many of them are daily wage earners. And for them to come and accept cancer care takes a very long time. And for them to actually come and accept treatment and complete it has several hurdles. And over the years, one by one, we never had a master class on this. And so each time we find a problem, we address it and we move on. And so our biggest learning is, and the bigger thing is, poor people are also afraid of going to hospitals. Many times we tell them, we blame them for coming late, but they're actually afraid when they have a problem, a healthcare issue. They're afraid of going to hospitals because they think the expenses will drive them out of pocket, that they will be on the streets. And so they will defer till they cannot bear it any longer. And so to promote health, to promote health-seeking behaviors, we have to educate them about cancer, about various other diseases, but also instill confidence in them that when they go to a hospital, they will not be out of pocket, that there are resources available in the hospital, in the community, that will help them access and complete care. And so confidence building for patients is as important as providing care itself.
Fascinating, doctor. What about the biggest source of satisfaction in all these years? What's your biggest satisfaction?
Yeah. So actually, on one hand, I have colleagues, younger colleagues who join me and who grow as professionals, who grow in their maturity in handling people. And that is one major cause of satisfaction. The other major cause of satisfaction is to see how the community changes, transformation that happens in front of our eyes, because in some part, because of the work that we do, that people come more often, they come to the hospital and they see 10 years ago, not even 30% of our patients were completing treatment. Today, a majority, almost 70-80% of patients complete treatment. Earlier, almost 90-95% of patients used to come with very advanced cancers. Today, some of them have started coming with earlier cancers. Patients feel free to come and tell us that they don't have resources and they need support. So all this transformation is an immense source of satisfaction.
How are you going to celebrate though, Dr. Kannan? Or have you already celebrated after knowing, how are you going to celebrate now that you won this award, the money that will come? How do you intend spending it, doctor?
I am not celebrating, but in the community, in the city where we live, there's a lot of ownership for this award. People feel recognized, people feel validated. And that is very, very satisfying. That so many people feel involved in what is happening and they take ownership for the recognition is very gratifying. Believe me, more than what is happening to me, to see people celebrate is a great source of happiness. And we are trying to reach out to the community. We are trying to take cancer care as close to their homes as possible. And I'm hoping that this recognition will help us move forward in that direction with greater speed.
A final question. Are you hopeful that the model you've created in a small place of Assam will now spread across the country, that affordable cancer care will in the next decade spread to every part of the country? Is that the hope and dream?
So we are a continent, and so we cannot have a one-size-fits-all solution. But this could be one of the models with modifications based on the geography and the location that could help make cancer care more universally available and acceptable.
Right. Well, Dr. Kannan, as I said, you've been truly an inspiration, and may many others follow your path in providing affordable health care to disadvantaged communities across this country. That really would make India a better place. Continue to inspire many others, Doctor. Thank you very much for joining me here
Thank you.
on the news
I also
today. Thank
believe
you.
the medical profession is one of the best professions in the world. Thank you very much.
It surely is.